the morning of surgery, what I'll do is I'll see if you have any questions, and then I'll take a marking pen and I'll mark the proposed incisions on the lower eyelids and then on the upper eyelids. I'll give you a mirror, and you say, that's fine, that's where I want it. Sometimes I find a crease, sometimes I find a wrinkle, sometimes I put it right underneath the lash line. And we could talk about the pros and cons of that, when you come back. And then I mark the proposed incision on your upper eyelids, and then I mark the proposed amount of skin on the upper eyelids that I think we need to remove. Okay. Give you a Xanax, see what kind of questions you have, get a good blood pressure on you, and then my staff will meticulously prep and drape you. I always do the lower eyelids first, because that's the most technically difficult for me. It's easy for you, but for me it's very difficult. It's just a very compulsive, meticulous procedure. So I get that over with first. Usually by the time we start, it's around 9 o'clock. It takes me about an hour and 15 minutes to do lower eyelids. I do the right one first, and then I do the left one, and we put in those tiny, tiny little stitches that will be dissolved in about a week. We give you a break, that's around 10-15, see if you want some water, see if you need to go to the bathroom, that sort of thing. And then around roughly around 10:30, I start the upper eyelids, numb up the right one, then numb up the left one, take out the excess skin, take out that fat pad, close it up real pretty, and then noon, we want you to kind of hang out here for a while, give you some soup, give you a sandwich, make sure you don't have any bleeding or any other issues. And then around 12:30, 1:45, you're going to have someone pick you up to go home. Okay. And then follow up, I'd like to see you. I know you live out of town. At the very least, I want you to give us a call. If we do it on a Wednesday, I want you to give us a call Thursday and Friday. Preferably, I'd like to see you Friday before the weekend. If you can't make it, that's fine. Then I want to talk to you because I want to make sure you're okay. Okay. And then the next week, Wednesday, Thursday, or Friday, depending on your schedule, my schedule, you're going to come back and we're going to start getting stitches out. That may be a couple-day process. We may leave a couple of them in, or we may take them all out, depending on how everything heals. Okay. The nice thing about what I do is that I supervise everything. I look over everything, what the nurses do, and sometimes we take out 1 or 2 stitches, sometimes we take them all out. I'm going to do what's best for you, not what's best for me. And then I'll see you a couple weeks after surgery, and then I'll see you a month after surgery, and I'll see you 3 months after surgery, then I'll see you 6 months after surgery. Just to kind of follow the path of what, make sure you're healing to my satisfaction. The upper eyelids, you're going to see a dramatic improvement before you leave the office. The lower eyelids, as soon as we do it, it's going to look beautiful. And then by the time you get home, it's going to look puffy, like I haven't done anything. The lower eyelids are a very delayed gratification. Because what happens is, remember we talked about taking out fat, but we have to keep some of the fat in to protect your eye. That fat sort of gets doughy and gets swollen. So it takes about 3 months before the fat of the lower eyelids, for the swelling to finally go down. It's a pretty safe surgery. The one issue that you may have with your upper eyelids is that you may have to come back 6 months later and might have to take out a little bit more skin because you have a lot of it. If I take out too much skin the first time, then you can't close your eyes. So I'm conservative. If I have to take out a little wisp of skin here, then we just do it at room cost only. Okay, so I'm very conservative and very safe, and you know that. I've never had to redo lower eyelids, but I think there's one lady that I have to redo. I think I left a little bit of I think I could have taken out more fat at the first time. But then again, the wisdom of this is you can always take out more. Right. You can't put it back in.
That's true.
Yeah, and I don't think that's going to be an issue with you. But if you take out too much fat of the lower eyelids, and you've seen this on TV, you get that cadaveric look. They look like it's a skeletal look, and I don't like that. I want you to be, number one, safe, and I want you to look refreshed.